Hello, this is Minseok. I'm a PhD student in Data Mining Lab, KAIST, and the presenter of today's paper. Now I will introduce the paper titled as Hi-COVIDNet, Deep Learning Approach to Predict Inbound COVID-19 Patients and Case Study in South Korea on behalf of other co-authors who participated in this research. Before starting the presentation, we express our deepest condolences to those who died of COVID-19 and thank all the related people who strive to tackle this situation. Today's presentation contents comprise of 5 sections. In section 1, we will introduce the research background and its significance. In section 2, we will explain the architecture and methodology of Hi-COVIDNet. In section 3, we will offer summarization of data sets we used for Hi-COVIDNet and other methods. After demonstrating the superiority of Hi-COVIDNet in the evaluation section, we will conclude our research in section 5. Okay, then let's begin our introduction. As we are all aware of, World Health Organization declared the COVID-19 outbreak, pandemic, on March 11th. 2020. If a chain of infections occurs simultaneously in more than one place in the world, it can be defined as an official pandemic. Truly, owing to its great infectivity, a huge number of people died of or suffered from COVID-19, and this devastating virus is still ongoing. Accordingly, the number of COVID-19 confirmed cases steadily continues to increase worldwide through physical contact between people, thereby putting more people in great danger. The cumulative number of confirmed cases is at least 14 million at the moment of this presentation, and is not expected to be decreasing in the near future. Here, an important fact should be noted that the spread of epidemics such as COVID-19 is usually initiated by infected patients from overseas who are exposed to the virus outside of a country and move into the country. To address this, most governments impose quarantines to monitor overseas inflow and prevent this infectious disease from entering across countries, while, at the same time, make the best endeavor to allow uninfected travelers to avoid stopping economic activity. Operating this special entry procedure requires allocating limited quarantine resources, such as medical staffs, quarantine facilities, or diagnostic kits in advance, and rapidly adjusting them to a potential new situation. Therefore, it is very important and helpful to precisely predict the number and trend of imported cases in the near future. Previously, although numerous studies have tried to predict the spread of COVID-19 with the help of various powerful machine learning methods, we do note that there has never been an approach to predict the imported cases before. Previous studies focused on expecting the spread of COVID-19 or other epidemics itself within a specific region, while, on the other hand, our interest is to predict the trend of imported cases from overseas in the near future, which is more practical for the quarantine at the border. So the objective of predicting the potential number of imported cases in a country can be represented as the sum of imported cases over countries, where each potential number of imported cases from a source country can be represented as a function of inbound passengers arriving from the country and its respective degree of infection risk, which comprises of various factors that change over time. Therefore, it is imperative for a prediction model to encompass such a complex spatial-temporal relationship, which is accomplished by our suggested approach, Hi-COVIDNet. Hi-COVIDNet is the first deep learning approach for estimating the upcoming number of imported COVID-19 cases to help the quarantine authorities allocate and adjust limited resources. Hi-COVIDNet understands the complex spatial-temporal relationship hidden in the imported cases data and also overcomes a relatively short period, which is 1.5 months of data collection for COVID-19 by exploiting the geographic hierarchy as well as a hierarchical objective function. The practicality and effectiveness of Hi-COVIDNet is demonstrated through a case study in South Korea by expecting the number of potential cases similar to the real-world confirmed imported cases as shown in the above figure. Now we are ready to describe the details of our methodology, Hi-COVIDNet. This is the overall architecture of Hi-COVIDNet, which consists of country-level encoders, color yellow, for each country to extract their respective infection risk and the inflow data using the daily epidemic information such as confirmed cases and death, and search keywords for the past couple of days for the former, and the roaming and flight statistics at the moment for the latter as input. These inputs are concatenated to model the function of the two aspects. Next, continent-level encoders, which are colored blue, derive geographical relationship among countries within a continent using the country-level encoder outputs, since the spread of COVID-19 is greatly impacted by the neighboring countries. Then the prediction layer, which is colored green, aggregates all the information from the continent-level encoders and predicts the number of potential imported COVID-19 cases in the near future. The model prediction result for the next K days, which is usually 1 or 2 weeks, can be used to help the quarantine authorities allocating their resources in the future. Detailed notations and explanations will be described in the following slides. Let's look at the components of Hi-COVIDNet in detail. The country-level encoder consists of a transformer layer, the LSTM layer, and concatenate layer, and is generated for each country to model its infection risk and inflow trend. The encoder requires two inputs: X, which is the daily epidemic statistics in the ith country in the past W days from day T, and AIT, which is the total inflow statistics from the ith country to a destination country at day T. More specifically, XIT consists of the variables for the confirmed cases and search keywords, and AIT consists of the variables for international roaming and flights. These data description will be described in a later slide. Initially, country's daily epidemic statistics data will be given into the transformer layer to highlight the significant period in the given data through attention mechanism. The transformer layer is shown to be effective because a specific period can have a greater impact on the COVID-19 transmissions among people. Then the output of the transformer layer is delivered to the LSTM layer, which captures the temporal trend of the COVID epidemic. Here, LSTM is a variant of the recurrent neural networks, which is called RNN, and has achieved the state-of-the-art performance in various applications with sequence data. To enjoy its pure performance, we keep the output of the last cell at day T to summarize the entire sequence. The concatenate layer combines the output of the LSTM layer, after all, and AIT. Recall that the former represents the risk of infection in the country, and the latter represents the total inflow from the ith country to the destination country of interest. Thus, the concatenated output is the hidden representation of the impact on the imported cases from the ith country's infection risk. Next, continent-level encoder aggregates the outputs of the country-level encoders belonging to the same continent, in that the spread of COVID-19 is greatly impacted by the neighboring countries, following the first law of geography, quote, "Everything is related to everything else, but near things are more related than distant things." As like the country-level encoder, each continent has its own continent-level encoder. Thus, a hidden representation is generated per continent, which reflects those of the belonging countries. Finally, to estimate the total number of imported cases, we further aggregate the outputs of the continent level encoders by adding another fully connected layer called prediction layer. The result of this layer is the predicted number of imported COVID-19 cases for our paper for the upcoming K days from day T in the destination country of interest. Altogether, first, the daily epidemic data of each country is delivered to the transformer layer of country-level encoder layer to highlight the significant infection layer, period. The output of transformer layer is delivered to LSTM layer to capture the temporal trend. The concatenate layer combines the LSTM output with inflow statistics. Then each country's infection risk representation is created. The continent level representation aggregates countries' infection risk representation within each continent through the concatenate and fully connected layer. And lastly, the predicted number of imported cases of COVID-19 in the upcoming K days is created. We note that Hi-COVIDNet is easily extendable to other diseases of interest. Although Hi-COVIDNet contains adequate components to understand spatio-temporal relationship, we further suggest a hierarchical objective function to fully take advantage of the geographic hierarchy. Our loss function considers, first, the prediction error on the number of the imported cases from each continent, and second, the predicted error on the total number of imported cases. Here, beta is the hyperparameter for adjusting the weight of the continent level error, and C refers to a continent out of 6 continents officially defined by KCDC. Y and Y hat are the total confirmed and predicted imported cases for upcoming K days, and YC and YC hat are the confirmed and predicted imported cases for the upcoming days of continent C. The overall training procedure of Hi-COVIDNet is outlined in this slide, especially in the algorithm 1. After preparing the dataset, first, country-level encoders estimate the risk of each country, followed by continent-level encoders to estimate the infection risk of each continent. And then the prediction layer estimates the total imported cases to the destination country. If not testing, but training, the hierarchical loss is calculated and all network parameters are updated by usual backpropagation used in deep learning. So as we completed the explanation about Hi-COVIDNet in this section, we would like to introduce the data we used for the Hi-COVIDNet. The data sets used in our research comprise of intra-country and inter-country information dataset. The first one is the confirmed cases dataset, which was provided by Johns Hopkins COVID-19 Resource Center. And second one is the search keywords dataset, which was collected from Google search trend for the 4 keywords, COVID-19, COVID test, flu, mask. And third one is the international roaming dataset, which was provided by Korea Telecom, the second largest mobile carrier in South Korea. It contains the number of roaming entrants from each country per day to South Korea. And fourth, the flights dataset, which was collected from the Airline Information System of Korea. It contains the number of daily cargo and passenger airlines arriving at Incheon Airport, the representative gateway to South Korea. The last one is the imported cases dataset, which was collected by KCDC. It contains the daily count of imported cases to South Korea, which are categorized by the originated continent. It should be noted that datasets from 1 to 4 are used as model input, while dataset 5, the imported cases dataset, is used as a label to predict. The above datasets are publicly opened, except third one, which is from KT, the International Roaming Dataset. And the data collection period for from March 22nd to May 5th, 2020. From now on, in this section, we will explain the practicality and superiority of our suggested Hi-COVIDNet under the case study in South Korea. For evaluation, collected data sets were divided into training and test sets based on May 5th. We set the window size to be 14, considering the incubation period of COVID-19, which is introduced in the reference paper below. Because our task is to predict the number of imported COVID-19 cases for the upcoming K days from day T, we used RMS error for prediction error for each single days. And methods compared in the evaluation are two popular time series prediction algorithms, ARIMA and LSTIM. We used two variants of LSTIM here. So we exactly compared three algorithms with Hi-COVIDNet. ARIMA and LSTIM SV only uses the variable of the number of imported cases as an input, while LSTIM NV uses the multiple variables. We repeated the training of each algorithms 5 times and report the average error value of them as the prediction results. For the training configuration, learning rate is 0.03, batch size is 1, considering the small size of the collected dataset, and beta is 0.5. We used ADAM for training Hi-COVIDNet, and other hyperparameters are favorably set to drive their best performance. As shown in the table, Hi-COVIDNet achieved the lowest RMSE regardless of the duration of the prediction. These results showcases the superiority of the hierarchical architecture of Hi-COVIDNet. Additionally, the RMSE of LSTIM MV was higher than that of LSTIM SV, despite more information, which demonstrates that naively adding information may even harm the model performance. Same evaluation results can be identified through the figure in the right side, where Hi-COVIDNet prediction results is the closest to the dynamic trend of imported cases among other evaluated methods. And also, we further show the Hi-COVIDNet's continent-wise prediction result, which is enabled by virtue of the hierarchical architecture of Hi-COVIDNet. Hi-COVIDNet continuously predicted a number of imported COVID-19 cases from America and Asia outside China. Because of both a high number of confirmed cases and a high number of inbound passengers during the period. For Oceania and China, Hi-COVIDNet expected no imported COVID-19 cases from them, since Oceania had no COVID-19 cases and few people entered from China during those periods. In fact, there were no imported cases. Additionally, to examine the effect of various factors such as hierarchical structure, transformer, and rich input data, we conducted the evaluation study. To summarize them briefly, the evaluation results prove that the Hi-COVIDNet contains essential components to understand the complex information inside imported cases of COVID-19. Finally, we can conclude our research in this section. The problem we focused is predicting the number of COVID-19 imported cases in the near future precisely in advance. This is very important because governments should estimate the imported cases and allocate its limited quarantine resources to prevent the spread of COVID-19 or other diseases from abroad in the future. Therefore, we propose Hi-COVIDNet, a hierarchical deep neural network model, which reflects the hierarchy of spatial contexts. To provide takeaway messages, we can summarize our contributions as follows. First, to the best of our knowledge, Hi-COVIDNet is the first deep learning approach to estimate the upcoming number of imported COVID-19 cases. And second, Hi-COVIDNet exploits a geographic hierarchy and a hierarchical objective function to overcome data shortage and understand spatial temporal context. The last one is Hi-COVIDNet demonstrated its practicality and superiority through a case study in South Korea. Okay, this is our presentation, and thanks for listening. And again, we express our deepest condolences to those who died of COVID-19 and thank all the related people who strive to tackle this situation. We sincerely hope that our research will help preventing the spread of COVID-19 further or other potential devastating diseases in the future. Thank you.